Are there daily shoulder mobility exercises that you should do every day to prevent frozen shoulder happening to you during the perimenopause, menopause transition? Here's the short answer. Yes. But the long answer is a little more complicated. You see, frozen shoulder has basically kind of two categories: primary frozen shoulder and secondary frozen shoulder. Primary frozen shoulder comes on because there is a chemical issue happening within. For instance, maybe your thyroid's having some issues, maybe there's diabetes, maybe you desperately need HRT, and there's a chemical piece to it. Now, secondary frozen shoulder happens because your shoulder freezes because it's trying to protect you, because maybe you tore your rotator cuff or your bicep, maybe you had a fall on an outstretched arm, and it's a protective guarding. I do believe all women over 40 do need to do mobility daily. Even if a person has a connective tissue disorder such as EDS, where there is hypermobility. It is just part of growing older that we have to take care of our joints, and that means the full range. If we take care of the full range, we can strengthen and optimize those muscles. So one of the simple things I tell women is, could you possibly do yoga 60 minutes a week? And I don't care how you break that 60 minutes down. It could be 10 minutes a day, it could be 2 30-minute sessions, it could be 1 60-minute session, but a sequence of yoga, so let's say sun salutations, would have some arm mobility within it. Now, some people do things such as functional range, some people do PT exercises, but the best exercise is the one you'll do. And I need you to find what you enjoy enough to do consistently, because we all need to move our bodies for the rest of our life. And I'm going to tell you, I'm going to vote for the yoga because it involves upper body, lower body balance, breathing, and grounding. And I don't think you can go wrong with yoga. It is usually very helpful and calming, because not only do I care about your joints, I care about your mental health and your emotional health, and the breathing that comes with yoga, you can't beat it.